Okay, let's unpack this fascinating deep dive into acupuncture.
Yeah, specifically its role in supporting fertility and, IVF.
And today, all our insights are coming from one particular source, the perspective and the research cited by the Berkeley Center for Reproductive Wellness.
Exactly. We're focusing just on what their material presents.
Right. Because the journey of fertility in IVF, it can be so complex. Anyone going through it is understandably looking for every single edge, every opportunity to maximize their chances.
Mm-hmm.
So our mission here really is to pull out those key nuggets of knowledge from this source about how acupuncture fits into that picture according to them.
Okay, so diving right in.
Yeah.
The Berkeley Center presents acupuncture not just as like a one-off treatment,
Right.
but as a really powerful ally throughout the whole IVF process, and even for just general reproductive health.
Yeah, and it's not just about that session right before or right after the embryo transfer, although they definitely highlight that.
They do.
But they also emphasize using it for general fertility health, maybe months before starting IVF.
And tailoring the protocols.
Yeah.
That's key.
Yeah.
For both female and male factors.
So what areas do they claim it enhances?
Well, their material lists quite a few.
Right.
Things like improving embryo implantation,
Okay.
optimizing the quality of eggs and sperm, helping balance hormones, and reducing emotional stress.
And they state this is backed up by a growing body of research that they've looked at.
That's what they report, yeah.
Okay. Now, from the Berkeley Center's perspective, there's one phase they really single out, the embryo transfer. They call it arguably the most critical stage in IVF.
They do emphasize that.
Yeah.
And they explain why. Success at that point really hinges on, well, two main things.
Which are?
The quality of the embryo itself, obviously, but also how receptive the uterus is. Is it ready to accept that embryo?
Right. And their material points out specific things that can kind of undermine that receptivity, that implantation.
Yeah, things like uterine contractions or spasms.
Makes sense.
Also, insufficient blood flow to the uterus, hormonal imbalances, and of course, stress. That comes up a lot.
Always stress. So the big question then is, how does acupuncture reportedly help get the body ready for this really critical step?
The Berkeley Center suggests it works on a few levels. Improving circulation, blood flow to the uterus.
Okay.
Helping to calm the uterus, reduce those spasms we mentioned.
Right.
And supporting overall hormonal balance. The whole idea, according to them, is creating the best possible environment for that embryo to attach and, start growing.
And this isn't just theoretical for them, is it? Their material points to research, they say, backs this up.
Yes, they claim research consistently supports a positive impact on IVF outcomes.
And they highlight one study in particular, don't they?
They do, what they call a pivotal study.
Yeah.
It's pretty well known in the field, published back in 2002 in Fertility and Sterility.
Huh?
Paulus and colleagues.
Ah, yes, the Paulus study. That one really made waves. According to how the Berkeley Center cites it, the findings were pretty striking.
What did they find again?
A 42.5% clinical pregnancy rate in the group that got acupuncture on transfer day, compared to just 26.3% in the control group.
Wow.
Yeah. That difference, as reported in that study, definitely caught a lot of attention.
I bet it did. And their material goes on to list other benefits they say have been confirmed by other clinical trials and meta-analyses since then.
Oh, good.
Well, improving blood flow, not just to the uterus, but to the ovaries, too.
Okay. That makes sense for egg development.
Exactly.
Mm-hmm.
Also reducing those uterine spasms and contractions.
We mentioned those.
Balancing reproductive hormones, modulating immune responses, which can be important for implantation.
Interesting.
And decreasing stress hormones, specifically cortisol.
And the bottom line, they state, is that all these things contribute to increasing both clinical pregnancy rates and, importantly, live birth rates.
Yeah. What's really fascinating looking at their overview is just how many different physiological pathways they claim acupuncture influences. It seems quite multifaceted.
It really does. Suggests it's impacting various systems that are just absolutely vital for reproduction.
Precisely.
Okay, let's dive deeper into the specifics for female fertility. How does their material say acupuncture supports that? First up is improving egg quality.
Right. And egg quality is, well, it's paramount for IVF success. Everyone knows that.
Totally.
So their material explains that acupuncture reportedly enhances microcirculation in the ovaries.
Microcirculation. So like the tiny blood vessels.
Exactly. Improving that tiny network ensures the developing eggs get enough oxygen and nutrients.
Okay.
They say this helps regulate blood flow, reduces something called oxidative stress.
Which is like cellular damage, right?
Basically, yeah.
Yeah.
damage from unstable molecules.
Yeah.
So reducing that and supporting hormonal balance, specifically through the HPO axis.
The hypothalamic pituitary ovarian axis, that comes up a lot in fertility.
It's the crucial communication line, brain to ovaries, controls hormones, egg development, the whole show, really.
And by optimizing this, they state acupuncture promotes healthier follicle development.
And improves mitochondrial function within the eggs themselves.
Mitochondrial function, remind me.
Think of them as the tiny energy powerhouses inside each cell, including the egg.
Ah, right. Powerhouses.
Their proper function is absolutely vital for the egg's health, its viability, especially after fertilization. It needs that energy.
Got it. Energy for the egg. Makes total sense why that's important. Okay, next point they make is enhancing uterine blood flow.
Yes. They really emphasize that healthy endometrial perfusion. That's the term.
Fancy word for good blood flow to the lining.
Exactly. Good blood flow to the uterine lining is essential for implantation.
So how does acupuncture supposedly help that?
Their material claims it enhances circulation by helping relax arterial walls, which promotes better delivery of oxygen and nutrients right to that lining. The goal, again, is creating a really nurturing, welcoming environment for the embryo.
Makes sense. We touched on balancing hormones via the HPO axis, but maybe we should reiterate how the Berkeley Center says acupuncture helps stabilize it.
Yeah, it's worth repeating. They state it optimizes the production and regulation of those key hormones, FSH, LH, estrogen, progesterone.
All critical for
Stimulating the ovaries, growing the follicles properly, and preparing that uterine lining.
Yeah.
It's all connected.
Right. Then there's reducing uterine spasms. How does that work, according to them?
They state acupuncture helps by activating the parasympathetic nervous system.
The rest and digest system.
That's the one. Activating that helps decrease those contractions and muscle spasms that could potentially interfere with the embryo implanting.
Okay. And now the big one, stress. This connection seems really key in their explanation.
It really does. Their material highlights how elevated stress negatively impacts fertility, largely by increasing cortisol, the main stress hormone.
And cortisol messes with the other hormones, right?
Yes, exactly. It can disrupt that delicate hormonal balance we just talked about.
So how does acupuncture help counter that?
Well, they explain that it reportedly helps by stimulating the release of endorphins and serotonin.
The feel-good chemicals.
Precisely. Which calms the nervous system, helps lower those cortisol levels, and in turn supports overall reproductive function.
So linking stress reduction directly to better hormonal balance and reproductive outcomes, that's a core part of their explanation.
It seems to be, yes.
Yeah.
A very important link they draw.
Now, it's really crucial we remember it's not just about female fertility challenges. The Berkeley Center's material is very clear on this.
Absolutely. They make the point that male factors contribute to nearly half of all infertility cases. It's a huge piece of the puzzle.
And they list some common obstacles they see on the male side.
Yeah, things like low sperm count. The term is oligospermia.
Okay.
Poor sperm morphology, which is about the shape of the sperm.
Right. Shape matters.
Reduced motility, or astenozoospermia, basically, how well the sperm swim.
Motility, got it.
And also sperm DNA fragmentation, damage to the genetic material inside the sperm.
That sounds serious for embryo development.
It can be, yes.
Yeah.
So their material outlines how acupuncture reportedly addresses these specific male issues, too.
How so?
For increasing sperm count and improving morphology, they point to things like enhanced testicular blood flow and better hormonal regulation.
Okay. Blood flow again.
Seems to be a common theme.
Yeah.
For enhancing sperm motility, how well they swim, they cite effects like reducing that oxidative stress we talked about and improving microcirculation in the testes.
Makes sense. And DNA fragmentation.
For reducing DNA fragmentation, they suggest it helps improve the sperm's overall integrity, which can lead to better quality embryos.
And does it impact male hormones too?
They also state it helps balance key reproductive hormones in men, like testosterone, LH, and FSH, which supports spermatogenesis.
Which is the process of making sperm.
Exactly. And the Berkeley Center claims that multiple studies they've reviewed show measurable improvements in semen parameters count, motility, morphology after regular acupuncture.
So they present it as a potentially effective complementary approach for male infertility too.
That's how they frame it, based on the evidence they cite. And they include patient anecdotes in their material, like one story specifically mentioning improved sperm motility and count after acupuncture treatment.
Suggesting their clinical experience lines up with these reported benefits.
It seems so.
Okay, let's talk timing. Because according to the Berkeley Center's material, when you do acupuncture seems pretty crucial. They have a specific recommended schedule.
They do. Ideally, their recommendation is to start sessions twice a week for a good 3 to 4 months before you even begin the IVF medication.
Wow, that's quite a lead-up time. What if that's not possible?
The minimum they suggest is just starting as soon as you can before that medication phase begins. Some preparation is better than none, is the idea.
Okay. What about around the embryo transfer itself?
That's when it gets very specific. They recommend one session within 1.5 to 2 hours before the transfer procedure.
Before.
And then another session within 1 to 1.5 hours after the transfer.
Before and after on the same day.
Yes. And then following that, they suggest continuing with sessions twice a week during that often stressful 2-week wait period.
Right. What's the rationale they give for this specific timing?
Well, the idea is that starting months in advance gives the body time to really, hopefully, improve egg quality, uterine receptivity, overall reproductive health, laying the groundwork.
And the sessions right around the transfer.
Those are more focused, aimed specifically at reducing stress at that critical moment, calming uterine spasms, and really promoting successful implantation right then and there.
Okay, that makes sense. So according to this source, who benefits most from adding acupuncture to their fertility plan?
Well, they state that it's generally safe and beneficial for almost all IVF patients.
Okay.
But they do find it particularly helpful for certain groups.
Such as?
Both men and women facing fertility challenges, really regardless of their specific age or diagnosis. It's presented quite broadly.
But any specific conditions they highlight?
Yes, they mention patients with conditions like PCOS, endometriosis, maybe those identified with poor egg quality, or immune imbalances that might affect pregnancy.
And on the male side?
Definitely patients dealing with male factor, infertility, low count, DNA fragmentation, motility issues.
And what about mindset or past experiences?
They also mention it being especially helpful for patients who've unfortunately had failed IVF cycles in the past, or those who experience really high levels of anxiety during the whole process.
Which is probably quite a few people.
Absolutely. And again, their material includes anecdotes supporting this, like a patient finding it invaluable for feeling physically and emotionally ready for the transfer.
Right.
And another who specifically noted the stress reduction and felt it contributed to improving her egg quality. Personal stories illustrating the points they make.
Okay. And finally, let's just briefly touch on the Berkeley Center's own approach as they describe it in their material. How do they position themselves?
They present their approach as an integration, combining reproductive medicine science, the standard IVF stuff, with traditional Chinese medicine principles, primarily acupuncture.
So a blend.
A blend, yes. And they emphasize personalized care, creating customized protocols depending on whether the main issue is egg quality or sperm health or implantation challenges, for example.
And they work with IVF clinics.
They mention coordinating closely with the patient's IVF clinic and providing a supportive, understanding environment, especially for complex cases. That's how they describe their service.
Okay, so let's try to pull together the key takeaways from this deep dive, focusing strictly on the Berkeley Center's perspective as presented in their material.
Right. The main message seems to be that acupuncture is presented as a vital complementary therapy, something to use alongside RT like IVF.
Not instead of, but with it.
Exactly. And the main benefits they report cover quite a range. Enhancing egg quality,
Decreasing uterine blood flow,
balancing hormones, significantly reducing stress.
and importantly, improving key male fertility factors too.
Right. And according to their material, the implication is that by incorporating acupuncture, potentially following the recommended schedule, patients might increase their chances of achieving a successful pregnancy.
Regardless of specific challenges or age, they seem to suggest.
That's the gist of their message. Yeah.
So it leaves you thinking. Considering all these different ways acupuncture reportedly impacts fertility, according to this source from the micro level, like blood flow and cell function,
all the way up to the macro level, like stress reduction and hormone balance.
how might integrating these kinds of diverse approaches, like the one the Berkeley Center describes, redefine the fertility journey for people?
That's a great question. And maybe what other complementary practices, perhaps working on similar principles, stress reduction, circulation, balance, might offer synergistic benefits when combined with conventional treatments? To think about.